Hello, everyone, and thank you for tuning in to our Live Well podcast for this session. My name is Jana Weaver. I'm the GPA Healthy Me and More coordinator and a registered dietitian nutritionist. Today, I have the pleasure of speaking with Dr. Dale Ragel. Dr. Ragel has been a trusted family physician in the Dallas, Texas area since 1991. Families from across the DFW Metroplex seek his care because he is known for providing a personal touch in the midst of today's high-tech healthcare atmosphere. Prior to entering private practice, Dr. Ragel served in the United States Air Force for 4 years. He is board certified in family medicine and serves as our very own GPA medical director. Dr. Ragel, thank you so much for joining today. I'm really looking forward to discussing this topic with you.
Thank you, Jana. It's great to be here.
Awesome. Well, I just want to start by saying that I love that you place a high priority on connecting with your patients and providing wellness and disease prevention strategies for individuals of all ages. In this Live Well session, I would like to discuss with you how stress can impact our health and how individuals can talk to their doctor about their stress and their mental health concerns. We know that stress is a natural reaction to life and life circumstances, but chronic stress can cause a variety of symptoms and impact our overall well-being. Before we discuss these symptoms and how stress affects our health, can you tell us the difference between that acute or day-to-day stress and chronic stress?
Yes, I could certainly try to do that. Acute stress is stress resulting from a specific event or situation. Examples might be being in a traffic jam, having an argument with your spouse, almost or getting in a car accident, or even getting in a car accident. Stress will cause a hormone called epinephrine, which is also called adrenaline, to be released. Adrenaline is the fight or flight hormone, which it will increase your heart rate, and it may temporarily improve your muscle strength and mental acuity. And it can be beneficial sometimes. You've probably all heard stories about people having superhuman strength and being able to move cars and heavy objects to save other people and so forth. So it can be beneficial in some situations. Of course, I called it the fight or flight hormone, and that's what it's designed to help us do. So, it's been around, it's been in our bodies for thousands of years. Today in the office, if you get upset at someone in the office, you don't fight them. That's probably not very good for job security. So in those situations, you generally should walk away or go and meditate or something like that. But that's a way of dealing with this fight or flight hormone, which can be helpful in some situations and harmful in others. On the other hand, chronic stress is a different story. Our body and brain really were not designed for chronic stress. In chronic stress, in addition to adrenaline, a hormone called cortisol is also secreted. Cortisol is a hormone that, when it is chronically elevated, can cause salt retention. And salt retention, as some of you may know, can cause your blood pressure to be elevated. It also causes weight gain by increasing our appetite, and it causes biochemical changes in our body which increase the fat in our bodies. So when it's chronically elevated, it contributes to the development of diabetes, high blood pressure, high cholesterol, and obesity. All of these conditions contribute to heart attack and stroke. So management of chronic stress is a big part of managing and improving your health.
Thank you for clarifying this and giving us this information. I think it's so important that as we start, we recognize that we all experience stress from time to time, but this chronic or long-term stress, if it's not effectively managed, it can be detrimental to our health. We talk throughout the Live Well program about how some stress can actually be beneficial, like you mentioned, and energize or motivate us to get things done. But it's that persistent chronic stress with no relief that can be problematic and lead to health concerns. What are some common symptoms of chronic stress and how it affects our physical health?
Well, some of the symptoms of chronic stress can include feelings of sort of free-floating or constant anxiety. You can also get depression, from stress, difficulty sleeping, which is called insomnia. You can also just experience fatigue and chronic irritability. Physical symptoms can include anything from shortness of breath, sometimes chest pain, abdominal pain, gastrointestinal symptoms, ranging from diarrhea to constipation and nausea. And in some cases, even vomiting can be stress-induced.
So, being able to recognize these common stress symptoms can help us manage them and know when to seek help. If someone listening is experiencing these symptoms, what would you recommend as a next step for them?
Well, if you're having a lot of physical symptoms or mental or emotional symptoms, and you're unable to deal with them, I would definitely seek medical attention, or if you have a mental health professional, you could seek help from them as well. But if it's becoming overwhelming, and especially if there's physical symptoms involved, like chest pain or shortness of breath, you definitely need to go and seek medical attention from your physician.
I agree. And sometimes stress may not be the cause of some of these symptoms. So that's why it's important to always see your doctor and have these conversations, whether it's about these physical symptoms you're experiencing, or even, as you mentioned, anxiety, depression, and other symptoms that are related to more of your mental health. So, Dr. Ragel, when you see patients that are experiencing, the chronic stress and maybe these stress-related symptoms, what are some of the main strategies that you give them to help them manage their stress?
Well, of course, first thing is to be aware of and recognize yourself the signs that you're under stress. And as I said, this could include feeling irritable or tired after a stressful day. Certainly, headaches can be another sign. Having disorganized thoughts, popularly known as feeling frazzled, can be another symptom. You can, however you experience stress, I think cardiovascular exercise, which is exercise that will raise your heart rate and help causes you to break a sweat, is an excellent way to deal with exercise. It's good, for example, to go to a gym, ride a bike, or jog. I realize it's not always desirable or possible to vigorously exercise every day, and it's also very good just simply to get out and walk in the park, walk around your neighborhood, helps relax you. Exercise of all types, whatever it is, helps reduce the stress hormones, and it makes you feel energized. It will also lower your blood pressure and helps lower blood sugar, helps lower cholesterol, and most people are probably aware that it also helps you lose weight. So many of the adverse effects of stress can be mitigated or overcome with regular exercise several times a week. Even just walking will help many of these things if vigorous exercise is not always possible. Another way to cope with stress is to speak with friends or family about what you're going through. Don't keep it bottled up inside of you. Just talking about it sometimes will help. They may or may not be able to help you specifically with whatever it is is stressing you out, but they can provide emotional support and a feeling that you're not alone. And kind of a segue to that is just spending more time with your family or friends can be a stress reliever, whether it's having an outdoor backyard barbecue, or relaxing and watching TV, or just sitting and hanging out and chatting. Spending time and enjoying time with those you love and care about is definitely a stress reliever for almost anyone. Also, improving your sleep quality will help with the feeling of chronic stress. You always should try to sleep about 7 to 8 hours a night, and try as much as possible to have regular times to go to bed and regular times to get up. I would always, try to avoid caffeine in the evenings or a heavy meal before you go to bed. Sometimes listening to music or reading a book before bedtime will help you relax and improve your sleep quality. So all these things require that you take time. You take time to exercise. You take time to spend with your family and friends, or to do things you enjoy. You take time to be able to go to bed in time, to have about 8 hours of sleep.
These are all such great strategies, and I really love that you mentioned just getting outside and walking, because like you said, research shows that being in nature can increase your energy levels, reduce depression, and just boost your overall well-being and how you feel. And we know that exercise or any type of movement, and I think you said this as well, is the best way to burn off those stress hormones. Some people that I talk to say that they don't have time to exercise or be active. For many people, our modern lifestyle is causing us to overcommit and, as they say, burn the candle at both ends. Stress symptoms can be like a wake up call telling us to pay attention to what's going on inside our bodies. What would you say to someone that feels that they don't have time to implement these strategies that you mentioned?
Well, the first step is to recognize the problem that you just mentioned. I would say the very thing you mentioned, I don't have enough time, or I'm burning the candle at both ends. These things can, in and of themselves, be a partial source of stress. And my response would be you absolutely must prioritize having downtime for yourself and to take care of yourself overall. I often tell people in my practice that if you don't take care of yourself, probably no one else is going to. It may be difficult. It may even involve completely reorganizing your life, but you must realize that you are important. You cannot take care of others. You can't be efficient on your job if you don't maintain your own health. You must take time to exercise, take time to eat properly, and take time to relax. So my take-home message is that if you feel that you don't have the time, then you must change your mindset, reprioritize, and take the time.
I completely agree with you. Changing our mindset when it comes to this and shifting your focus is so important when you're looking at managing or embracing stress. I also want to take just a minute to go back to the importance of reaching out to your doctor or mental health professional for support. We've talked a lot about the effects of stress on your body and your physical health, but let's talk for just a minute as well on how stress impacts our mental health. At the end of this session, we provide tips on how to start this discussion with your doctor, because as we know, this can be a challenging conversation to have with your physician or even with your friends or family. It can also be confusing as to who to reach out to or who to see. So as a healthcare provider, can you simplify this process for individuals and provide just some direction on maybe what type of mental health specialist? Can you tell us what this looks like, and kind of you as a physician, as a doctor, how you can help someone that may be looking to find a mental health professional or to have this conversation?
Absolutely. And if you're feeling confused, I think your physician can help you with this. And no matter how challenging it feels, it's important for individuals to share any concerns about stress when meeting with their physician. And you can even go to your physician simply for that problem if you're experiencing stress, even if you're not going for any other reason. Chronic stress, as I've mentioned before, can cause anxiety and depression and other mental health problems even. In some cases, your physician may be able to help you, through brief counseling of his or in his or her own office, and in some cases can give you some medication. Although I think coping skills in addition to medication will always be important. Physicians can also, if needed, help refer you to a mental health specialist. That's it's especially important if you don't know who to go to. There are many types of mental health professionals. There are psychiatrists, psychologists, what they call licensed professional counselors, pastoral counselors, and social workers. And depending on what your specific needs are, one type of these professionals may be better than the other. And I think your physician can help, one, tell you what type of professional you may need, and then two, help you find one that can see you. So your physician can help you find the appropriate mental health professional based upon your needs and desires.
Definitely. And speaking of experts and professionals, as a physician, I'm sure your role can be really stressful at times, especially if your schedule is very busy, if you're seeing patients that, may be chronically or terminally ill. What are some of the ways that you personally cope with stress?
I try to do some of the things that I've already spoken of. I often exercise or take a walk after a stressful day, for example. I also have made it a priority in my life to get adequate sleep. A few years ago, I went through a period of time in my life in which I was bringing a lot of work home, and I was leaving. Not only was I bringing a lot of work home, I was also leaving the office late. And I soon realized that I was not sleeping well because I was not allowing myself time to sleep. And being in a profession in which I'm promoting health in others, I realized how insane this was. I reorganized my life, cut some things out of my life, improved my work efficiency and so forth, so I, could leave the office on time and I didn't have to bring work home with me, and I had more downtime at home, and I had enough downtime that I could get in bed in time to get adequate sleep. So I was making that a priority. I reorganized my life to make this happen. I immediately noticed my energy level and mental acuity went up, and not only did this allow me to get more sleep, but it also allowed me to spend more time with my family, which is in and of itself a stress reliever. And I also often will read a book or listen to music, and most important, I always block off several hours a week to either relax or be able to spend some time doing what I enjoy doing. And so I took, I have experience in this, and as I said, I felt like at one time I wasn't getting enough sleep, and that magnifies your stress when you don't get enough sleep, because not only does it reduce your coping skills, you're just tired, and it makes you grumpy. So that's what I did, and I can, from personal experience, that's what I actually did at one time in my life.
And these are great, and I love just hearing the transparency from you as a physician, and how you put your own advice into practice, and really kind of took a moment to reprioritize. And I think we can all be guilty at times of taking on too much, of not managing our stress, not embracing things, or even for me, learning to just actively relax. And so I like to add in a few of my own things as well that I do, and that is learning to actively relax. Our mind seems to be always on work, or always on, as a woman sometimes, what else I need to be doing. And so whether this is deep breathing or yoga, or like we mentioned earlier, going for a walk, I like to find an active relaxation technique that helps me improve my physical health, and just really just find a way to relax. And another thing that I would like to share as far as a technique is taking supplements. And most of you know, and you heard in the intro, that I'm a registered dietitian nutritionist. So this is very important to me. And so if you're not already taking vitamins and supplements, I would highly recommend that you consider taking a multivitamin, and then looking at your diet, and if you're not getting certain nutrients, then adding these as a supplement to help you balance the stress response. And some of this would be adding extra vitamin D, or maybe adding a B complex for energy and to help boost your mood. And so stay tuned to the Live Well podcast, because I am going to add some more information on this in a following session where I interview another dietitian and we talk more about this in detail. And so to our listeners, I would also like to add, what technique or strategy would you add to this list to manage your stress levels? These are some of mine and Dr. Ragel's favorites, things that we do that help us, but we would like for you to add your own to this list. And we just really hope today that you have all gained a greater understanding of how the impacts of chronic stress on your body and mental health, and how we can overcome this, and you can seek help if you need it. Thank you so much, Dr. Ragel. This has been so informative, and I love just hearing, as I said, your personal strategies and input on this subject.
Thank you, Jana. I've really enjoyed this conversation, and I completely agree with coming up with your own list of coping skills would be very much in order. And so I really enjoyed this, and thank you for having me.
For sure. And to wrap things up, I would like to encourage everyone to take some time this week to ask for support, like Dr. Ragel mentioned, and reach out to your friends and family and set up that appointment with your doctor. Your support system can play a big role in helping you manage your stress and live mentally healthy. Use the tips and resources we provided on how to talk to your doctor. If you feel your level of stress is impacting your health, please reach out to your primary care physician or a mental health professional, such as a counselor or psychologist. For more information on finding a mental health professional, go to the National Alliance on Mental Health website at www.nami.org. If you need additional support or have other questions during the Live Well program, please reach out to us. You can email Healthy Me and More at wellness@gpatpa.com. Thanks again for joining us today.